health now, making it easier for more people to argue.
You heard that right, argue. Experts say conflict can be good as long as you follow a couple of rules. And as long as everybody knows the rules. Dr. Jean Berezin joins us right now, a psychiatrist and the executive director of Clay Center for Young, Healthy Minds at Mass General. Doctor, it's always great to see you. So many people hate conflict, right? Especially within their own family. But why is it so hard to avoid it?
Well, first of all, it's a normal part of all human relationships, but we haven't learned generally how to manage, understand, and resolve conflict. And in families, it's especially painful in two situations. One, when it's hidden and a parent is angry or resentful at a kid, kids know what's going on. And the other one is when it's actually overt and expressed in kind of an angry, horrifying way for the child. So these are painful situations.
And doctor, in some cases, people just stop talking to each other altogether. So what would you do with your expert opinion to get that conversation rolling again?
There are a number of principles. First of all, we want to keep our emotions under control. We want to focus on the conflict and not the person. Don't call the person names. Focus on the problem. Make the problem transparent. Be prepared to apologize. It's also super important to have frequent open conversations about conflicts, to be non-judgmental, and it's not about winning. It's not about everybody agreeing. It's about learning to love and respect each other despite our differences.
Well, but doctor, we'd have to retool ourselves for that because we want to win, we want to be right, we want our position to be the right one. So are there situations where it's better to just, take a deep breath and walk away?
Well, about 1 in 3 families have an estranged family member. That means somebody that actually has walked away. And sometimes it's for their own benefit because they've either been abused or neglected. They've had adverse childhood experiences, such as parents with substance use disorders who've been incarcerated, impoverished. They've been traumatized, and it's for their own mental health, essentially. Now, they need to focus on themselves. They need to take stock of the situation. They need to get love and support elsewhere, and be prepared to come back because everybody wants to re-engage in the family.
Right.
But oftentimes it takes a professional to be involved and help them get back in and heal the wounds.
Right. Heal the wounds, that's the goal. Dr. Berezin, thank you so much. We appreciate it.
Great to see you, doctor. Take care.
Great to see you.